You've been trying for a baby for over a year, doing all the right things, but still no pregnancy. Let's talk about infertility without the awkwardness, of course. First of all, let me say you're not alone. Infertility is common, and the good news is there is help. Now, there are two types. You have the primary fertility, when you have never been pregnant before. You have secondary infertility, when you've been pregnant before, but it's just that you're trying to try for the next one, then you're not getting pregnant. And guess what? It's not just the woman's issue. You have to go along, you see. And so why it's important that both partners need to be checked. So my gentlemen, don't just sit back. And not that you watching this video is you're just watching something about someone. No, it could be you. For women, some of the causes includes ovulation issues like PCOS or other hormonal imbalances. It could also be pelvic problems like fibroids, endometriosis, or even blocked tubes. And it could also be as a result of infections like sexually transmitted diseases. And PID, these can cause lasting damage to the reproductive system. For men, it could be as a result of low sperm counts or no sperm at all. So you could have sex and you ejaculate, but it doesn't mean there are sperms in the semen. So you may think, oh, and a bakama, but my dear, it could be empty. It could be just water. You could have the color and all. It could be just water. No sperms to fertilize your woman's egg. It could also be testicular abnormalities or even some penile abnormalities like Peyronie's disease. Erectile dysfunction is also a cause. So how do you know something is off? For women, you could have irregular periods or even no periods at all. You could also have symptoms like excessive facial hair growth. For men, you could be experiencing some problems with performance in bed. You could have unusual penile discharges. At times even changes in your testicular size. Now, the best thing to do is to see your doctor immediately. And when you get there, they could do some tests like blood tests to check for infections, the hormone levels, and they could also do thyroid function tests. For the men, the semen could be analyzed to find out if you have sperms in the semen and to find out how good the sperms are in the first place. For women, you could also do a type of X-ray to check the fallopian tubes to make sure they are not blocked. And that test that will be done include vaginal swabs, blood glucose, and hormone levels. Let's even the much better news. Treatment exists. There are medications to help you with ovulation and also to help you with the hormonal issues. There's also surgery options for blocked tubes or even testicular problems. There's also what we call assisted reproduction like the IVF, the artificial insemination, and even embryo transfer. Each of the above will go with counseling because, Charlie, this fertility journey can be very, very stressful. Very, very, very stressful. Look for more tips.